This is Dr. Gary. Right now, most people are overwhelmed with all the information out there about COVID-19. Please stick with me because rather than just numbers or theory, I'm going to tell you what's the latest information and some effective factors you might want to consider. From the current data sets, we're going to have several rough months ahead. By late April or May, all the hospital beds and ventilators in the United States will most likely be full, and we will need to take care of ourselves, something that most people are not used to doing anymore. Realizing it is a serious virus, at least 10 times more deadly than the regular flu, the majority of people who are relatively healthy will either have mild symptoms or recover. If you have an autoimmune disease, over the age of 70, or other chronic health conditions, be even more careful. Now on to the positive. You see, we have decades of knowledge about viruses and how to support the immune system, and we need to systematically apply the information now with a calm, level head. There's a lot of disinformation, misinformation, and honestly, some real garbage information out there that's being thrown around right now. You see, viruses all basically do the same thing. They invade a cell, take over some of its components to make copies of themselves, and those infect other cells, and then sometimes infect other people. The difference between the coronavirus that causes the common cold and one like COVID-19 is the potential of a lower respiratory tract infection, which can lead to other things such as pneumonia. Well, because these viruses live in the lungs, they can get in and out of the airways pretty easy and are more infectious. Just yesterday, the new research was published in the New England Journal of Medicine, indicating that the virus can last on plastic and stainless steel for 2 to 3 days, cardboard up to 24 hours, and copper 4 hours. This alone will cause us to modify what we do. Now, it's always been true that a comprehensive strategy is necessary to fight any virus, and in our clinic, our nutrition supplement strategy includes support for inhibiting the way the virus attacks and inhibiting the way the virus reproduces. And we have effective immune support protocols that provide this comprehensive support, and these protocols are tailored to each patient's specific situation. Now, here's some things we need to do. I encourage you to do the whole social distancing thing that has been recommended by the public health agencies. Log into my Instagram, which is dr.wellness, because I will be having creative ideas on a regular basis how to deal with stress and anxiety, so that many who are struggling both now and into the next several months will have some resources. Unless you absolutely have to, stay away from hospitals or major medical facilities. Having a box of rubber gloves in your house is a good idea just in case you need them. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. If you've recently come in contact with a symptomatic person, or that you're experiencing a cough or fever or difficult breathing, please remain at home, rest, and get the appropriate testing. Test kits can now be sent to your home from some of the online labs. Don't hoard, but have at least 2 weeks of good nutritious food on hand. Fresh vegetables and fruit may be hard to get, and frozen is a good alternative. Contrary to the fake news, there are lots of effective natural agents based on significant scientific data and their mechanisms of action. Some of my top picks are elderberry, monolaurin, vitamin C, vitamin D, andrographis, garlic, and onion. I could spend 30 minutes on each of these compounds describing why and how they work, and at some point maybe I'll post a short Instagram or Facebook story about how each of them work without getting too technical. Nanosilver can be used for both a topical disinfectant as well as an oral for your immune system. Your general diet is utmost importance, and this is where most people falter. It is very counterproductive to eat a poor diet and then try to make it up with vitamins and supplements. During this time, try to decrease the junk food, even though it sounds really good, because the junk food diet is probably the worst at this point. Also, keep sugar to a minimum and drink at least 50% of your body's weight in water per day. I know that's kind of hard. Exercise helps your immune system function at a higher rate. Most any type of exercise is good. It doesn't have to be intense. It just needs to be done on a regular basis. And you see, prevention is always the way to go, rather than waiting for symptoms to develop. Now, we must also strengthen the immune system and the whole body health in general. And I want to emphasize that last point. Optimal health is not just being free from symptoms, but rather having a body that's adaptable to stress without breaking down. The stress can be from a physical, emotional, and even things like the COVID-19 virus. Your body's adaptability to stress without breaking down is called your adaptation response. and we want to do all we can to keep our natural resiliency high. You see, in the end, we cannot avoid this virus. We have to go through this. And rest assured that I am with you. I'm dedicated to your health every step of the way, and together we can expect to emerge stronger. Even though I'm in Montana, I see people from all over the country. I've been doing the telemedicine thing when most people did not even know what it was. Oh, how times have changed. So stay calm, be smart, and let's keep ourselves in the best position to remain healthy and happy. Remember, together in community, we are stronger.